how do some of those coping mechanisms show up? Like you said, you can become numb, you could become distracted, you could kind of move into some kind of avoidant situation. And I think that there's times when that's appropriate because like what you just said, you have to go to work, you have to take care of your family, you need to keep showing up in spite of the fact that these things are happening. And so can you just give us a little bit of insight as to like, what do some of these mechanisms look like? How might they manifest? And what should we do about it? Like, what I'm curious about is if there's an appropriate amount of time. I know you said everyone's got their own timeline, but for these things to be okay for a while, and then at some point you go back and you try to just like, okay, I need to feel these feelings. I need to process this stuff. But we talked to us a little bit about that.
Yeah. And I feel like I need to do a brief overview of the 3 states of the nervous system to really go into that. And so we have the 3 states. One state would be the parasympathetic state. That is where we are in our best health, at our best self. Things feel manageable. Then we have the sympathetic state, which is stressed, active danger, active threat. And then we have the overwhelm state. For those people who may know about the dorsal vagal response, Dr. Stephen Porges' work with understanding that the vagus nerve actually has this other communication system that communicates overwhelm and shuts things down. And so when we're looking at coping mechanisms, we can see which state of the nervous system am I in with these coping mechanisms. Because it is entirely possible to be stressed and to keep going. It's entirely possible to be in parasympathetic and to feel what's going on and yet still be able to function. It's that overwhelm response that really is where things go into full numbing and distracting that are not necessarily going to be the best for our health, for our physiology, for our biology. And yet they may be the best that we can do at that time in our life. And so there's nothing wrong with it, but it definitely is something that we want to continue to work on because that exactly right there, like that, Jess, is trauma pattern, is that overwhelm. And so when a person kind of looks at their overall sense of being in their body, are they intentionally or even unconsciously doing mechanisms, coping mechanisms, adaptations to completely block off feelings? Because that's clearly the overwhelmed state. Or are they able to move through and they're able to feel it, carry it almost, and not let it affect their ability to stay connected with themselves, to stay connected with other people? And so it's are you not feeling it, or are you able to feel it, keep it manageable, and move through your day with that? And so I like to bring in this word manageable, because anything that feels manageable, we're going to be able to stay in a healthy place and move through the stages of grief by keeping things manageable, by keeping the emotional experiences manageable. The sadness, the anger, right? Anger is a normal stage of that grief process. For many people, because of their prior life experiences, it is not safe for them to feel angry. And so that's what they block off. And that will not allow them to move through all the stages of grief. And yet, if we can come alongside them and teach them these tools that they can use to help keep their feeling of anger manageable, well, then they can move through that and not need to completely block it off. And so some of the coping mechanisms, I mean, there's a whole wide range of them, right? And certainly with my experience being an addiction medicine doctor, that is one form of coping mechanism of reaching for substances that will numb feelings.
Okay. So we've got people drinking more, going to the boxed wine, smoking marijuana, smoking cigarettes.
Anything, right? Exactly.
Caffeine, sugar.
Pain pills, right?
Pain pills, emotional eating. Pills,
yeah. And even the anti-anxiety medications. People will find themselves reaching for those earlier and earlier. And it's not to manage panic anymore, or like the pain pills, it's not really to manage pain anymore. It's actually to help numb the emotional sensations that are coming up from the body. And when they just notice that, ooh, like I'm starting to reach for these in order to give myself this effect, that's when we know that, okay, like your body is at the place where it feels that these emotional experiences are unmanageable and it's needing these additional, what they're using. I mean, those are tools, right? Those additional tools in order to keep things manageable. But to keep things manageable, it does mean stuffing it down. It does mean numbing it. It means, hey, it feels like an 8. That feels unmanageable. Well, if I take a pain pill, that brings it down to a 5, brings it down to a 4. That's more manageable for me. And yet it will prevent someone from moving through the stages of grief because we're numbing things in the process.